What is menopause? Menopause is a natural biological process that marks the end of a woman's reproductive years. It is defined as the permanent cessation of menstruation, which typically occurs between the ages of 45 and 55. During menopause, the ovaries stop producing eggs and levels of reproductive hormones like estrogen and progesterone decline. Menopause is considered complete when a woman has gone 12 consecutive months without a menstrual period. Menopause causes. Menopause is a natural biological process that occurs as a result of aging and the natural decline of reproductive hormones in a woman's body. The exact cause of menopause is not completely understood, but it is thought to be due to a combination of genetic and environmental factors. As women age, their ovaries gradually produce less estrogen and progesterone, which are the hormones that regulate the menstrual cycle and play a key role in reproduction. This decline in hormone production leads to changes in the menstrual cycle and eventually the cessation of menstruation. Certain medical treatments or conditions may also cause menopause to occur earlier than expected. For example, women who undergo a hysterectomy or have their ovaries removed may experience sudden menopause due to the surgical removal of reproductive organs. Other factors that may contribute to early menopause include chemotherapy or radiation therapy for cancer treatment, autoimmune disorders, and certain genetic conditions. Additionally, lifestyle factors such as smoking, excessive alcohol consumption, and poor diet and exercise habits may also play a role in the timing of menopause. Menopause symptoms. The symptoms of menopause can vary from woman to woman and can range from mild to severe. The first signs of menopause usually include changes in menstrual periods, such as irregular periods, lighter or heavier periods, or missed periods. Other common symptoms of menopause may include hot flashes, a sudden feeling of warmth that spreads over the body, often accompanied by sweating and flushing of the skin. Night sweats, hot flashes that occur at night, which can interrupt sleep and cause insomnia. Vaginal dryness, reduced vaginal lubrication, which can cause discomfort, pain during intercourse, and an increased risk of vaginal infections. Mood changes. Women may experience mood swings, irritability, anxiety, depression, or difficulty concentrating during menopause. Sleep problems. Insomnia or difficulty sleeping can be caused by night sweats or hormonal changes. Fatigue. Many women experience fatigue or a lack of energy during menopause. Changes in sexual function. Menopause can affect a woman's libido, cause pain during intercourse, and affect sexual pleasure. Other less common symptoms of menopause may include headaches, joint pain, urinary incontinence, and changes in the skin and hair. What happens during menopause? During menopause, a woman's body undergoes a number of changes as a result of the decline in estrogen and progesterone production. These changes can affect various parts of the body, including the reproductive system, bones, and cardiovascular system. Reproductive system. As the ovaries stop producing eggs, menstruation becomes less regular and eventually stops altogether. Women may experience irregular periods, shorter or longer cycles, or heavy bleeding during menopause. The decline in estrogen production can also cause vaginal dryness, thinning of the vaginal walls, and a decrease in sexual desire. Bones. Estrogen helps to maintain bone density, so the decline in estrogen during menopause can lead to bone loss and an increased risk of osteoporosis. Cardiovascular system. Estrogen helps to protect against heart disease by increasing levels of good cholesterol and reducing levels of bad cholesterol. Therefore, the decline in estrogen production during menopause can increase the risk of heart disease. What conditions cause premature menopause? Premature menopause, also known as premature ovarian insufficiency, POI, occurs when a woman experiences menopause before the age of 40. This can be caused by a number of factors, including genetic conditions. Certain genetic disorders such as Turner syndrome or Fragile X syndrome can cause premature menopause. Autoimmune diseases. Autoimmune disorders such as lupus, rheumatoid arthritis, and thyroid disease can cause premature ovarian failure. Cancer treatments. Radiation therapy or chemotherapy for cancer treatment can damage the ovaries and cause premature menopause. Surgical removal of ovaries. Surgical removal of the ovaries, also known as an oophorectomy, can cause sudden menopause. Infections. Certain infections, such as mumps or tuberculosis, can cause inflammation of the ovaries and lead to premature menopause. Chemical exposure. Exposure to certain chemicals such as chemotherapy drugs or pesticides can cause damage to the ovaries and lead to premature menopause. Women who experience premature menopause may be at increased risk for certain health conditions, such as osteoporosis, heart disease, and certain types of cancer. Therefore, it's important for women with premature menopause to seek help with their decoder to monitor their health and manage any potential risks. Menopause is different in each woman. In general, the symptoms of perimenopause last about 4 years. Menopause diagnosis. Menopause is typically diagnosed based on a woman's symptoms and medical history. A healthcare provider may also perform a physical exam and order blood tests to measure hormone levels. Blood tests. A blood test can measure levels of follicle-stimulating hormone, FSH, and luteinizing hormone, LH, which are hormones that regulate the menstrual cycle. During menopause, FSH and LH levels increase as the ovaries produce less estrogen and progesterone. Thyroid function test. A thyroid function test may also be ordered to rule out thyroid disease, which can cause symptoms similar to menopause. Pelvic exam. During a pelvic exam, a healthcare provider may check for any abnormalities in the uterus, ovaries, or cervix. In some cases, imaging tests such as ultrasound or bone density scans may also be ordered to assess bone health and screen for any potential abnormalities. It's important to talk to a healthcare provider if you're experiencing symptoms of menopause, as there may be other underlying conditions that can cause similar symptoms. Menopause treatment. Menopause is a natural biological process and doesn't always require treatment. However, some women may experience bothersome symptoms that can be managed with lifestyle changes, medications, or hormone therapy. The best treatment plan will depend on the individual's symptoms, medical history, and personal preferences. Lifestyle changes. Simple lifestyle changes can often help alleviate mild to moderate menopause symptoms. These include 1. Regular exercise. Exercise can help improve mood, increase energy, and promote better sleep. 2. Balanced diet. Eating a diet rich in fruits, vegetables, whole grains, and lean protein can help manage weight and reduce the risk of chronic diseases. 3. Stress reduction techniques. Practicing stress reduction techniques such as meditation, yoga, or deep breathing can help manage anxiety and improve sleep. 4. Avoiding triggers. Avoiding hot flash triggers such as caffeine, alcohol, and spicy foods may also help reduce hot flashes and night sweats. Medications. Certain medications may be prescribed to manage specific menopause symptoms, such as 1. Hormone therapy. Hormone therapy, also known as menopausal hormone therapy, involves taking estrogen and sometimes progesterone to alleviate symptoms such as hot flashes, night sweats, and vaginal dryness. 2. Antidepressants. Certain antidepressant medications can help manage hot flashes, mood swings, and sleep disturbances. 3. Vaginal estrogen. Low-dose vaginal estrogen in the form of creams, rings, or tablets can help manage vaginal dryness and discomfort during sex. Alternative therapies. Some women may choose to try alternative therapies to manage menopause symptoms. These may include 1. Acupuncture. Acupuncture involves inserting thin needles into specific points on the body to alleviate hot flashes and other menopause symptoms. 2. Herbal supplements. Certain herbal supplements such as black cohosh and red clover may help alleviate hot flashes and night sweats. Women should work closely with their healthcare provider to determine the best treatment plan based on their individual needs and medical history. Regular checkups with a healthcare provider can also help monitor for any potential health concerns related to menopause.